inligting oor Protex se Nuven Provi Fumigation Fogger. Besoek protec.co.za.
Nou goed, Sondag is 'n wêreldkankerdag en vanoggend kuier Olivia Curlewis by ons. Sy is van CANSA en ons gesels meer oor hierdie dag. Good morning, Olivia.
Good morning, Jennifer. Morning.
It's lovely
Kia.
having you here.
Thank you for having me.
Such a pleasure. I think it's such an important topic to speak about, World Cancer Day. Where did World Cancer Day start?
It started in the year 2000 on the 4th of February by the UICC, which is the Union for International Cancer Control. And so that means it's been running for 24 years.
Wow.
It's been such an issue for so long. And in places like this, and cancer especially, you guys have really worked towards ringing the bell for cancer patients, for ring the bell of awareness and shouting it from the rooftops. We need more help. We need more contributions. We need more effort. We need more solutions. But this year, cancer cases this year, what is it looking like? Are people getting cured? Are we there? Is it getting better? Are there more cases of cancer happening? What's the statistics say?
Unfortunately, the statistics are rising. And, I think COVID also played a very big role because during COVID, cancer was pushed aside. So a lot of people that were diagnosed during that time didn't get treatment. So now we are seeing the consequences of the COVID years. And they didn't have access to treatment. So it's on the increase. And unfortunately, our whole health system is in a state of people are traveling far distances to get treatment, and then they arrive there and they don't have treatment. They've got long waiting queues. They have to, screening is not done, access to medicine. All that is a problem at the moment in South Africa.
What is the theme of World Cancer Day this year?
Closing the care gap, access to all, trying to level the playing grounds, have that everybody has access to cancer control, to cancer treatment.
I think you just mentioned some of the problems we face in South Africa, and that's not even to say people that are on medical aids. I mean, we speak about medical aids and people get cancer, but even those...
It's not a given.
It's not a given that you will be able or have access to the cancer treatments, and I think it's really quite sad and shocking for someone that's already diagnosed with cancer then to be faced with, well, sorry, you still might not be able to afford it or it won't be given to you. And that's not even speaking about the people that don't have medical aid that you just mentioned, the people that have to travel long distances to stand in queues. And very often we have people that sit here and say early diagnosis is so important. Yet the reality is that so many people don't have access to early diagnosis.
Well, that's what we keep pumping on. We keep saying, go for your screening, know your body, because early diagnosis leads to a better prognosis. But once you are diagnosed, now you've got to start jumping the hurdles to get access into the system. When we talk about the public health system, to get into the system, and once you're in the system, do not default, do not miss an appointment, do not anything, because then you fall out of the system and trying to get back into it. But then those that do get access into the system, as I said, they're long waiting queues. They will maybe be diagnosed now and say, well, your treatment can start in 6 months' time. And somebody diagnosed with cancer doesn't want to hear that they can start their treatment in 6 months' time. They traumatized, they want to know, they want this cancer dealt with right now. And then you get people that are on medical aids, but now they've got to get authorization from the medical aid, and the medical aid will then decide, well, this treatment is too expensive, let's rather look at this, so we're not going to authorize this. And think where the treatment that the oncologist has put forward is the best plan of action for that person, but now they have to go through a lot of red tape to be able to be on the treatment that is the preferred treatment for that patient.
I think the frustration with this is not someone going to go buy a car and you have time to wait. This is something that affects not only the person that gets diagnosed life, it affects their family, their friends. There's a psychological, emotional trauma with above just the physical that you're going through. And no one wants to hear, sorry, I'm sorry, you're not going to get the cancer treatment. We think it's too expensive in your medical aid. No one wants to hear we can start in 6 months' time. Some cancer patients don't have 6 months to wait for you to decide, now we can start to help you.
And the sad thing about it is that 80% roughly, of the cancer patients in South Africa are dependent on state hospitals and state medical treatment.
Absolutely, 80% are. And they, and even if they do get into the system, then they go into the system, they start getting their treatment. Now they have to go for radiation. Radiation is every day for 6 weeks. Monday to Friday, you have the weekend break, Monday to Friday. Now you live in a rural town, you live far. Now the radiation units are all in our big metros.
Yes.
Now you live far away. So the cost implication, because you don't get admitted, you've got to go every day to that treatment center to get your radiation. And that's where CANSA, where we try and assist the patients, where we have these care homes, all in the big metros, where the patients can stay whilst undergoing radiation treatment. They get transported to the hospital and back, and then get nutritious meals, and then, of course, emotional support for our support groups and that type of thing.
Often people say, right, we support cancer, but what happens with cancer? It's nice to hear that these are the things that cancer is busy with, that to start these support homes and to start something as basic as transport back and forth between the homes and the treatment facilities. What can the rest of us, especially companies in South Africa, because there's a lot of companies that have to do a lot of work in communities. What can they do?
Pierre, they can support cancer's fundraising initiatives. We have Shave-a-thon coming up. It's one of our biggest fundraisers, where it's in solidarity with cancer patients. As you know, whilst undergoing chemotherapy, a lot of patients lose their hair. So the concept of Shave-a-thon is you shave your head, or you cut your head, or you color your hair in solidarity with somebody that's been diagnosed with cancer. And it starts now in February, and this is one of our biggest campaigns. So companies, get involved with Shave-a-thon, because those are the funds that we need to be able to keep these care homes open and running and transporting the patients and having the support groups and having our telecounseling line, which is a counseling line that we have in 7 languages, where people can phone in. You know what COVID did teach us is that things can be done digitally or virtually. Before COVID, we weren't open. We used to travel long distances to have meetings. Now everything is over Zoom or Teams or, that type of thing. And now that's where the telecounseling line was born, because people were afraid. They didn't have the support that they needed. And we couldn't visit them because of the lockdown. So the telecounseling line came in, where people could phone in and say, I need to be able to speak about this. I'm afraid. My family's afraid. And as I say, it's in 7 languages that we offer this. And these are qualified counsellors that are manning the telecounseling line.
Olivia, I mean, we started by you painting the realities of the situation in South Africa, and I'm very thankful, and I think Pierre also mentioned it, very thankful for a cancer that makes such a difference, but a difference that you could feel and that you can see. And I think it is really important for companies and individuals to really, as far as they can, to support cancer. It's such a good cause. If I have a company and I've got an employee with cancer, how do I support them?
Jennifer, it's very important that companies, they all have corporate social investment funds, they have employee wellness funds. CANSA offers a wellness package where we go into companies and we do screening at the companies. There is a cost involved, but this is usually paid because we have to have, obviously, nurses, and we've got lab fees and we've got consumables that we use. So we have the Cancer Wellness Program. It's a fantastic program because it takes you right into the company. No time off work, no time having to go to the doctor, no time having to sit at a clinic if you haven't got a medical aid for the whole day. So, people have come back and said, I didn't even think of going for a pap smear or a breast examination or PSA, which is your blood test for men for prostate cancer. And, these are taken right into the company. They can have their tests right there and then. The results go back to the company. The company also gets a profile on the wellness of the company. And if we do find cancer patients there, which sometimes the company's not even aware of it because they haven't spoken about it, this is where we can give them the necessary support. We can sometimes have a face-to-face support groups, or we can then link them onto a virtual support group if they so feel, with lots of WhatsApps of virtual support groups. So companies, we need them to become involved. They need to promote healthy lifestyle. We have smoking cessation programs, where companies, it costs a lot of money to go onto these programs, where CANSA has a program that's an online program called Kick Butt, and they can join this. And of course, that all leads to a healthy lifestyle and reducing your risk of cancer.
Wow. Olivia, thank you so much for your time, for not only educating us, but also sharing a bit of hope through companies like CANSA that really makes a difference. So thank you so much for your time this morning.
You're welcome.
Dit is natuurlijk Olivia Curlewis van CANSA. Daar het jy ook nog hoor. Februarie is 'n tyd vir Shaveathon. So neem deel, maak 'n verskil. Jy kan ook natuurlik 'n verskil maak. Bly gerus geskakel. Net hierna se tyd vir jou nuus, jou weer, jou finansies en dan gesels ons ook sport met Jacques en Janie Baker by ons.